Hi, I am Dr. Vishant Deo, General Laparoscopic and Cancer Surgeon at Star Hospital, Siliguri. Today we are going to discuss about the colorectal diseases. Usually what happens if the patient comes with a problem of change in the bowel habit and passing of bright red blood whenever he goes to the toilet. So if these two types of symptoms are there, what happens? The patient while goes to the toilets, he or she passes the bright red colored blood in the stool and with some hard stools coming out. That can be the anal fissure or the hemorrhoids. In these two conditions, there will be a painless bleeding. The treatment for these two are very simple and we can operate it, and some lifestyle modification can treat these type of diseases. When the patient has pain around the anal canal, that is the perianal pain, and there is discharge of the pus in the perianal region, that can be a perianal abscess or the fistula in ano. The treatment for both of them is surgery. When the perianal abscess is there, we need to cut that and give an incision and drain the pus. And if there is a fistula, we can operate with the many types of surgeries that includes even the dyed laser therapy, and the result of both of these treatment is good. What happens if the patient has, then comes the colorectal cancer. So this is increasing day by day in the Indian population also. 50 to 60,000 of colorectal cancer is coming up yearly in India. And it is more dangerous is that the younger age group is getting this cancer very frequently. So we are here in my OPD also, we come to see the younger age groups coming with the many symptoms leading diagnosis, coming out to be a colorectal cancer. So what are the symptoms of for these? The patient may have change in the bowel habits, passing of blood in the stool, anemia, weakness, weight loss. Problem is that these type of symptoms can occur in above diseases which I discussed. So there is a confusion. So patient thinks there is these symptoms are because of those benign diseases. But when the patient comes to the OPD and when we diagnose it, we are seeing that so this disease has advanced and the whole of the treatment protocol changes and the prognosis of the patient changes. So if the patients have these type of symptoms more than 6 weeks, so please do consult a doctor, do consult a surgeon or medical gastroenterologist. So what we do, we usually do the sum of the tests. The most important and the gold standard test for diagnosing a colorectal disease is the colonoscopy. It's a very simple test. It shows where there is the mass, or if there is a mass, the biopsy can be taken up. That can prove whether this is a cancer or it's a benign disease. And other tests depending upon the scenario, CT scan or the MRI can be done. So what happens if the colorectal cancer has come up in the diagnosis? It is a multidisciplinary treatment is required for these type of diseases. So which includes a surgeon, a gastroenterologist, a radiologist, a medical oncologist, radiation oncologist. So whole team is required. We usually here in our hospital also, we are able to treat the colorectal cancer very successfully. We are doing the surgeries of this. So what are the surgeries? Either we can do an open surgery or the laparoscopic or the minimal invasive surgery. Nowadays robotic surgery has also come up, but the laparoscopic surgery is still the gold standard for the colorectal cancer. And here I am able to do many of the laparoscopic colorectal cancer surgeries. So the result, and after when the surgery is complete, the tissue which has come out, we send it for the biopsy, and the final pathological reports directs us whether the patient requires radiotherapy or the chemotherapy. Whatever is required is being done. So the theme is that if you have symptoms of change in the bowel habits, regular or frequent, and bleeding per rectum, and there is a pain in the anal area, you have a tenesmus, and there is a weight loss, please do consult a doctor, investigate it. If there is a disease, diagnose it timely, and the timely treatment can give you the good prognosis. Thank you.